What's going on, everyone? Happy Tuesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you are sick with something else or you did test positive for COVID, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, May 28th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you, such as H5N1, which we're going to be talking about in just a moment. It's not a big health threat to humans yet, but it's something that's out there. It's something that's evolving. It's something we have to be on top of. We also have to be on top of heat-related illnesses. Here in the United States, it's going to be coming summer. Summer is starting. Heat-related illnesses are already starting. We're going to talk about that today. And, of course, we're going to take a look at some virus levels around the country. New Walgreens data, new data from BNO. They did their weekly update. And maybe we'll even take a look at a few wastewater sites as well. And, of course, some of the states that we normally look at. So if you're new, subscribe down below. It's the best way to stay informed with what's going on. And of course, share these videos with anyone you know. Give them a thumbs up. The more people that hit that like button, the more YouTube will push this out throughout the algorithm. Let's try for 100 to 125 thumbs up today from that like button. And of course, share this with anyone you know and comments down below. Okay, starting off with H5N1 today. Alpacas, yes, alpacas are now infected with H5N1 avian flu in Idaho. This is relatively concerning for many different reasons. It says here, virus found in 4 of farms, 18 alpacas. So it happened in 4 out of 18. But here's where it gets a little bit interesting. Let's go over to this tweet now on X, or post on X, as we have to call it nowadays. Helen Branswell said, USDA reports H5N1 bird flu in alpacas from farm that had a poultry outbreak back in March. The detection of H5 in alpacas, this is the same virus that's been found in cows, as we know. This is where it gets a little bit interesting. Right here, confirmed on May 16th. And she says, not clear why USDA took so long to report. Again, it was confirmed on May 16th. Today is May 28th. Why did they wait so long? Why did they wait so long to report that? Why not report that the day of or the next day? Okay, so maybe they want to, I don't know, get further confirmation? I don't know. I mean, they already had it confirmed. Did they not want to jump to conclusions? I mean, what's the deal? It is May 28th, May 16th. That's over 12 days ago. We need transparency. We need to find out these things faster. All right. Taking a look at this now on X as well. A lot of things from X today. Dennis, the COVID info guy. And always tweets great stuff. Long COVID patients twice as likely to suffer from depression and anxiety. Well, you know what? I can give you a lot of reasons why. When you're dealing with long COVID, number one, you're constantly feeling unwell. You're constantly having health problems. Of course, that's going to make you sad. It's going to cause you to feel depressed. Anxiety, well, when your long COVID gets pretty bad, guess what? You aren't able to go to work. You are out of work in some cases. Some people are losing their houses. Some people are losing their ability to go and do daily activities. I mean, that creates depression and anxiety, especially when you're out of work. That creates anxiety because then it becomes a financial problem. So many people have had that happen. And this is not a small study. It's a study of 25,122 adults reported that people with long COVID or post-COVID-19 conditions twice as likely. That's what was found in this study. That's what they did the studies they conducted, is what I'm trying to say. All right, moving on. BNO's weekly update. New cases, they report, are at 54,482. Again, remember, this is an estimate. The average is 45,848, so that's higher than the average. In the hospital, 1,000 676. In the ICU, 195. New deaths, 434. The average is 478, so the deaths are lower than the average, and they do note limited data, and it's true. It is limited data. Many states are reporting an uptick in cases for the third week in a row, while COVID levels are still relatively low. It suggests that cases are once again slowly rising. We can agree with that. The CDC has the epidemic status for COVID, and there's been various states for the past few weeks now that have been seeing increases to either likely or it definitely are in epidemic status. We can actually pull that up here, and you can see here how there are growing and likely growing. It does exist in several different places, such as Texas, Louisiana, Arizona, Montana, and Massachusetts, Hawaii, Louisiana, all they are definitely growing. Then you have some likely growing areas. Alrighty, going back now to BNO. This week, only 40% of hospitals submitted COVID data, down from 43% last week and 91% the week before. Actual case numbers and hospitalizations are higher than reported, and of course we know that. Wastewater alone suggests that probably right now we're close to about maybe 400,000 cases a day in the United States. Yes, that's a lot of cases. Data in this thread is meant to interpret the current trend. And I say that's a lot of cases, 400,000, which would probably be the estimate right now. Mind you, back during the winter wave, we got over 1.5 million cases a day wastewater was detecting. This is the 219th week in a row with more than 400 new COVID deaths in the U.S., or nearly 1.2 million during the same period. I mean, each time it drops, so they were doing 500 a day, 1,000 a day, then it went below 500 a day. I get it. They're just trying to show, okay, now it's been 219 weeks. I imagine if it goes below 400, they'll say how many weeks it's been since 300 deaths a day. Whatever. It is what it is. And then they finally put, so far this year, nearly 3.3 million COVID cases have been reported in the U.S., causing 283,605 hospitalizations and 29,370 deaths. All right, we also have to take a look at this. This is something I tweeted out last night. This HKTDC, honestly, I don't know who they are. They just recommended it for me for some reason on Twitter, but apparently it was a healthcare conference or convention of some sort. Just watched a little gif of pictures. This is healthcare, mind you now. Do you see anyone wearing a mask? These are healthcare professionals. Come on. How hard is it to put on an N95 or better mask? It's not that hard. Then I was on the good old Facebook last night. Meta. Take a look at this. Here's another maskless event. And these were people that treat oncology, nurses, that treat cancer patients. None of them masking. So you mean tell me they're going to go back and treat their patients and maybe some of them could be infected? It doesn't even have to be COVID. Could be something else. Utterly, utterly ridiculous. Let's take a look at today's allergy levels. 52% of the country is in medium status. What you do not see is any red on the map today. That's good, but there are some places in medium status. Here in Pennsylvania, we have a lot of it. The plains, the Midwest, there's quite a bit of it. There's some places in the yellows and green as well. Look at Maine. Almost all of Maine, 99% of Maine, is in the green today. That is a good thing. Taking a look at what is going on with air qualities in the U.S., and we're going to see much of what we have been seeing lately, and that is red down in southern Texas. Not as bad as the previous few days, and we can see there's some oranges, and the oranges do spread along the Gulf Coast, almost down into portions of Florida as well. Good air quality today across portions of the Mid-Atlantic and Northeast. Just some minor concerns along Maine, down through Boston, but really, this is one of the better days in the United States aside from this. Los Angeles, very bad air quality today. We know you have a lot of traffic out there. Is there any wildfires ongoing in California? I haven't heard any reports about wildfires. If anyone's following me or watching this from California, let me know. Do you know if there's any wildfires today in California, or what could be causing this to be worse than we've seen in some time? Look at this. Pasadena, Los Angeles, yeah, that is concerning. to see your levels. Northern California doesn't look, or Central California doesn't look to be doing too bad. All right, moving on now. Taking a look at the heat-related illness map. In the east, it's been increasing. It's increasing in some of the southern states. It's increasing in the west. It hasn't increased yet in Texas. I suspect it may come soon because it's been hot down in southern Texas. I have to show you this. This is from last week. Just found out about it yesterday. More than a dozen Massachusetts children recovering from heat-related illness at a track event. So yes, there was a track event in Massachusetts. And you know, the temperatures, they weren't even all that hot. Yes, they were in the upper 80s up there, but they weren't in the 90s yet. And already, I'm telling you, anyone who has had a case of COVID and may have just even a minor issue going for anyone who's had a case of COVID, I'll tell you what, you're susceptible to breathing issues on days where the humidity, the air quality is bad, it's high heat. I think we are going to see an increasing number of heat-related illnesses, not only from people who have had COVID, but just from areas where temperatures are getting hotter as well. And it's something we're going to have to keep an eye on going forward. And taking a look at today's heat-related, excessive heat warnings, and we can see here, it's not too bad today. There are heat advisories up in southern Texas. Let's see what that is all about. And we can see here, this is pretty hot. 111 degrees in southern Texas. That is better than yesterday. Here's another one for 114 degrees. But remember, we were seeing 117 and 118 degrees over the weekend. Taking a look now at this. Hey, you want to learn more about climate? I do have another Twitter account where I do talk about that. It's called Climate Data Report. And hey, it's slowly starting to grow. It's up to 359 followers. Let's see if we can get up to 500 by the end of June. I'm going to really try and do a lot of tweeting on that going into June. All right, getting back to health now. EMS calls in Philadelphia yesterday, 725. And we do have the holiday weekend total. 2,382 EMS calls over the holiday weekend. And right off the bat, those who are not familiar with my channel, those who haven't seen one of these videos before, I have to remind you of something. We have one of the biggest here in Philadelphia. We have one of the biggest and busiest, I should say, busiest fire departments in the entire country. One of them. I don't know if we're number one. We'll definitely probably make top 5. So it's not out of the normal to have days where we go over 800 EMS calls. I can recall, just about a month ago, there was a day where I think we were over 900 EMS calls in one day. It happens, and I'm really concerned as to what's going to happen when we get a heat wave. So mind you, this is a 3-day total. It's not a 1-day total. That's a 3-day total for EMS incidents. Let's take a look at what's going on in Montgomery County, Pennsylvania. Whoa. Okay, I'm seeing calls that I do not like seeing here, and I'm seeing several of them. Cardiac emergency, nauseous and vomiting, stroke, cardiac emergency, cardiac arrest, dizziness, fall victim, cardiac arrest again. So, yeah, there's a lot of cardiac issues going on. White Marsh, Hatfield Township, Lower Providence Township, 17 EMS calls right now. That is busy for 5:48 p.m. Hopefully some better news in Chester County. Wow, no, not better news. Matter of fact, this for Chester County is really busy for this time of day. Sick person, overdose, respiratory difficulty, fall, stroke, heart problems, respiratory difficulty, another cardiac arrest, heart problems, and some other stuff going. Wow, yeah, this is not good to see. Cardiac arrest. That's a very bad call. Pretty much. Ugh, yikes. Yeah, just not good to see. Let's take a look at what's going on with Walgreens this week. Hopefully some better news here. Well, we don't have any good news here. The positivity rate in the United States, it's continuing to go off. But mind you, it's going up from the lowest levels. Again, I said this a couple weeks ago. When we were back down to 13%, that's the first time Walgreens was down near 13% since 2022. That's not too bad. I mean, it is going up, but again, we are still in some of the lowest levels. I mean, we're starting to come back up into 2023 levels. Walgreens this week is at 18.6%. The prior week was 17.5%. Difference of up 1.1%. Total test, 3,658. That is down from the previous week's 3,697. And I suspect we're going to continue to see a slow and steady build with Walgreens. I mean, it is up 1.1%, so I mean, it's not a major rise, it's just a slow rise. Let's take a look at some states. We'll look at some states that are rising and some that are also in the green as well. Of course, there are a lot of states not reporting this week. Maine, New Hampshire, Vermont, Massachusetts, nothing from Missouri, nothing from Iowa, nothing from Nebraska, South Dakota, North Dakota, Montana, Wyoming, Utah, Nevada, Oregon, Alaska, and even Hawaii, nothing this week. That's kind of disappointing about Hawaii. I would have liked to have known what Walgreens would have shown for Hawaii, because if you saw yesterday's video, Hawaii's wastewater, it's really starting to go up right now, and they are, I believe, in the very high status on the CDC page. Let's see here. Yeah, Hawaii is reporting very high levels at this time for wastewater. All right, starting off here with what is going on in Connecticut. 22.7% positivity rate. The prior week was 3.1%. That's a difference of up. Wow. 19.6%. Less test. 22 versus 32. Even if you know what? Even with that less test, yeah, that's 10 less. I think even if they did more testing, that positivity rate would still be up. I mean, that is a big increase, 19.6%. What's going on in my state today? Some good news. 8.9% positivity rate. The prior week was 12.2%. Difference of down 3.3% total test. 45 versus 41. Taking a look now at Virginia. Yeah, this is not good. 21.9% positivity rate, 12.9% last week. That is a 9% increase total tests. 96 versus 101. Let's come down to Texas now. And in Texas, the positivity rate is 18.3%. Prior week was 15.3%. And if we look at this chart here, we can see here, it is starting to go up relatively quick, a little bit faster now. 3% increase, more testing, 726 versus 622. How about Florida? And Florida this week, 17.6% positivity rate versus the prior week, which was 17%. Difference of up 0.6%. Total test, 609 versus 547. So we've seen testing increases in some states. I think the reason why nationally testing is down, there's just so many states not reporting. How about California? Yeah, California's seeing a testing increase as well. 21.7% this week. The prior week was 20.7%. Difference of up 1%. Total test, 217 versus 179. And we'll do one more place. I want to end on a positive note. Let's take a look at Oklahoma, which actually saw a drop this week. 4.2% positivity rate for the current week. 17.1% last week. That's down by 13%. Testing did drop too, so, I mean, the positivity rate dropped with testing dropping. That's really good. And they were seeing a little bit of a bump in the road there for a little while. You can see here, the positivity rate went up. You know, it had that period where it went up, but now it's going down. 24 tests versus 35. Coming over to New Jersey, not much I can say about New Jersey. 148 hospitalizations, 54 out of 70 hospitals reported. We're not even going to bother with the full data. 7 people on a ventilator, discharges 12. I mean, a lot of hospitals are missing. Hopefully we get more tomorrow. New York State reports 442 new cases. Taking a look at hospitalizations in New York State, and I do need to zoom this in as it refreshes on us. We did not start a new week with New York State yet. We'll do that tomorrow. There'll probably only be 4 reporting days this week. That's usually how a holiday week works. Hospitalized patients, 489. That dropped. I expect there'll be a slight rise tomorrow. And in the ICU, 43. Alrighty. On a final note, I do want to mention today that, hey, we're coming back from a major holiday weekend. A lot of people just traveled. A lot of people had their first day in the office today. Did you happen to notice anyone that sounded sick in the office or at work today or in school? Anyone coughing? Maybe it did, maybe it didn't. I think there's going to be an increase in the number of people sick. Not necessarily from COVID. COVID, we know, is just having a bump in the road right now. That's what projections are showing. And then it's a big question mark as to what happens for the rest of the summer. Some are saying it could go up big time. We'll just have to wait and see what happens. We honestly don't know. And remember, just one case of COVID can give you long COVID. Just one case of COVID can wreck your immune system. And so many people have damaged immune systems right now. That's why I'm saying, do you know anyone who's sick right now? Because the social media post, I've already saw one today. They're saying, oh, we went to the New Jersey shore this weekend, and now we're not feeling well. Anyone else have this bug that's going around right now? I mean, it's not necessarily always going to be COVID. With wrecked immune systems, other stuff is going to transmit so much easier. Alrighty, folks, that does it for the Tuesday edition of the Pandemic Update. If you like this, give it a thumbs up down below, subscribe down below, share this with anyone you know, and leave a comment down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday evening. Thanks for watching.